We will be going over how to transfer in and out of bed. This is an important transfer to know how to do appropriately after your surgical procedure. For purposes of this demonstration, we will be using this leg as Teresa's surgical leg. So it is usually easier when getting in and out of the bed if you sit on the side where your non-surgical leg can get in first. So what she will do is she will swing her good leg in, and then as a caregiver or a sister, they can help support the leg, getting it into the bed till they are comfortably in the position that they need. Then to get out from that position, we move the opposite direction. The caregiver can help assist the leg off the side, bringing it down, and they can sit up and stand up from there. Without assistance from a caregiver, it can be performed by the patient themselves. They can cheat by hooking one foot under the other heel, and they use their good leg to help lift the leg up into the bed. Lie back and uncross. And then to get up, they repeat the process, hook that foot under their leg, use their good leg to lift, swing over the edge of the bed, and sit up. One final trick that can work is you can use a cane to hook the bottom of that foot. So Teresa will demonstrate using the cane to hook the bottom, help lift it up, getting into bed, and then getting out, hooking the foot again, helping assist it, swinging over the side, and sitting up.
Transferring to the tub is one of the first big transfers that you're going to have to do within the first few days after your surgery. Usually you're allowed to shower around 3 to 4 days out unless your surgeon says different. So what I'm going to have you do is you're going to safely or carefully step back with your walker. You're going to reach back for your shower chair and you're going to sit. If you can keep your knee and keep the knee underneath you, you can. If that's uncomfortable, you can always kick it forward. When you do your shower the first time, do have someone present so that in case you get overheated or fatigued as you're showering, someone's there to help. They can move the walker out of your way. And then what you're going to end up doing is helping that leg up and over the side, or your caregiver may help you get that leg up and over the side of the tub. You may help with your hands, and then bring it around, and then the other leg comes in. To get out of the tub, you do the exact opposite, and you bring it up and over. With that one, there are a couple tricks. Depending on your surgery, you can use your other leg as long as it does not break your precautions. You can hook underneath and swing around and then coming back. Or you can go ahead and use a cane hooked underneath your foot and help lift your leg up with the cane. And then make sure that you dry off and make sure your floor stays dry when you get up to stand after you've taken your shower. When you're transferring from a chair or a toilet, what you want to remember is go ahead and take your walker and back all the way up till you can feel the item you're going to sit on behind you. Then what you're going to do is position your surgical leg a little bit forward just to make it a little bit easier to sit down. If you can do it without doing that, you're more than welcome to do it. Your joint replacement should be fine. Go ahead and reach back for the chair and then slowly sit down. When you get up, it's going to be the same thing. You're going to move your leg forward a little bit. You're going to go ahead and push off from the chair or the toilet and then stand up and walk. The one thing that's a little bit different is with a posterior hip replacement, you want to stay in a little bit more of a reclined posture to make sure you follow your hip precautions. So when you go down with a posterior hip replacement, what you're going to end up doing is back up until you feel the chair, kick your leg forward, reach back, and kind of stay reclined back and use your arms a little bit more, maintaining that greater than 90-degree bend at your hip. Transferring to the car becomes really important after leaving from surgery or coming to your physical therapy appointments. With that, what you're going to do is you're going to take your car seat and put it back in the far position, and then you're going to recline it back to give you the most leg room to get in and out of the vehicle. You're going to back up to the vehicle, sit down on the seat, and then go ahead and either have your caregiver lift your leg into the car, or you can use the strategies of using the cane or your opposite leg as long as it doesn't break your precautions. Once you're ready to travel, you will want to raise the back of your seat up into a normal position so that you can wear your seatbelt appropriately.